Most New Year's resolutions involve some promise to get healthy. Unfortunately, despite our good intentions, most of us won't reach our New Year's resolution goals. The doctor is in, and today we are talking about a resolution that you can keep and easily keep. Schedule your annual mammogram. Dr. Scott Ackerman, one of the First Coast leading oncologists, joins us every Friday to talk about the important issues. Welcome.
Thank you, Jennifer. Good seeing you.
Good to see you too. Well, let's start talking about the mammogram. When should a woman get a mammogram?
Well, there's been a lot of press lately. You've heard a lot in the media about when to get mammograms. And there's been different guidelines for the past couple of years. There's been some modifications to the guidelines a little bit. But my recommendation still is that women should start getting a mammogram on an annual basis, beginning at age 40, and then as long as they maintain good health. So if they're very old, if they have other illness, maybe that's when one could stop. As long as you're in good health, over the age of 40, you should get a mammogram every year. But mammograms aren't the only thing to do for breast cancer screening. It's really three things to do. First is mammogram, again, annually starting at age 40. The second is a clinical breast exam. That means seeing a physician, your gynecologist or your internist, and then he or she could do a professional breast exam. That should be done annually as well, and maybe starting at age 30 when you go for your gynecologic visit. It's a good time for the physician to do a breast exam, and also breast self-examination. Now, women should do breast self-examination on a monthly basis, beginning in their late teens or 20s, as soon as you have breasts, so you understand where in your breast the normal little lumps or bumps might be, because all women have normal mammary tissue within their breasts. There's some nodular tissue that all women have a little bit here and there. So by doing a monthly exam of your own breast, you'll know where those areas are, and you'll be able to sense changes from one month to the next or from 1 year to the next. So that's the normal woman. But women who are at high risk for breast cancer, meaning that if you have a strong family history of breast cancer, or perhaps you have a genetic predisposition. And now, with a lot of the genetic analyses that we're able to do, we're identifying certain families and certain people that may be at enhanced risk for breast cancer. Women like this should speak to their physician about cancer screening, breast cancer screening, and maybe having them done a little bit earlier. Maybe starting, I recommend to women who have a strong family history of breast cancer that they start their mammograms at age 35. And there's other imaging that could be done as well in those women, but they should speak to their doctor.
What about, are there any women who shouldn't have a mammogram? I mean, what about women who have a breast implant or women who have had breast cancer before? The
question comes up a lot. A lot of women have breast implants, breast augmentation. So the question is, should they get mammograms? Should they get other tests? Are mammograms appropriate in those women? Well, if you have a breast implant, you still have breast tissue. And you can have a mammogram. The implant makes it a little bit more of a challenge, but we in medicine don't mind challenges. Right. And so when you have a mammogram and you have an implant, the mammography technologist needs to do some additional tricks to get a good view of the breast. There's ways that we can move the implant a little bit away and be able to image the breast tissue appropriately to find cancers. And I've seen a number of women with implants that have had cancers caught early because of mammograms. Also, women who've had cancer, if they've had a mastectomy, certainly nothing to mammogram there, but the other side, the other breast, if it's still intact, is at slightly higher risk of developing breast cancer than the normal population. So she should absolutely get a mammogram on an annual basis on that breast, and some other imaging as well. So there you have it with women with implants and women with breast cancer. They should have mammograms still.
Okay. I've heard some talk about radiation, concerns involving the radiation of a mammogram. I mean, should there be a level of concern involved with that?
I think it's healthy to be concerned about radiation exposure. Radiation exposure can lead to cancer. We know that radiation can cause cancer, and we certainly don't want to see overuse of CAT scans or any kind of imaging where we're doing too much of it that we cause cancer. Mammograms, however, have very little radiation. And over for 20 years, there's been very little radiation involved with mammograms. We have mammogram machines called digital. We do digital mammograms now. And because they're digital, it takes very, very little radiation to get a good image, not decent, but a quality image of the breast where we can find breast cancer. So there's very little radiation. The benefits of mammography on a regular basis far outweigh the potential risks of developing breast cancer, developing any other problems.
And I mean, we just talk about how early detection is so key a lot of times
Sure.
with this. Now, when you're looking at a facility to go get a mammogram, what are your recommendations? Where should we look to go?
Well, there's lots of good quality facilities that we have here in Northeast Florida. We have a really good health system in Northeast Florida. We're really blessed in that regard. But there's a few things to keep in mind when choosing where to have your mammogram. You want to go to a facility that performs mammograms on a regular basis, where it's something that they do often. You want to go to a facility that's accredited by the American College of Radiology. That means that the radiologist is board certified. It means that the technologists that do it are held to a very strict standard for quality of care. You'll also want to go to a facility that offers a whole comprehensive package of breast imaging services, things like ultrasound or breast MRI or molecular imaging of the breast. These are all important tests that sometimes we need to do as an adjunct to the mammogram, and it's nice to be able to have it done in the same place where your mammogram is being done. And finally, make sure you go to a place that your insurance will pay for, because certainly you don't want to be out of pocket more than need be.
For sure. We have just less than a minute left. Let me ask you, are women listening? I mean, what are the numbers of women who are actually getting mammograms on a yearly basis?
Well, in the 80s, the percentage of women in Florida that were getting mammograms as per American Cancer Society guidelines was only about 50%, 45–50%. But now it's over 70% of women in Florida are having their mammograms done as per these guidelines annually. And it's really hard to get much above that. There are certain women, there are only so many. Those last 20%, 25% are tough, because these are women that may not want to go, that may have challenges getting access to care. So we're doing pretty good, I think, in Florida.
Yeah, that's definitely encouraging.
Yeah.
Well, thank you, Dr. Ackerman, for being here today, and a Happy New Year to you.
Thank you. Happy New Year to you, Jennifer.
Thank you. All right, well, thank you, Dr. Ackerman, for sponsoring this segment. If you have questions regarding today's topic or any other health questions, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.